Why do lung cancer patients get scan-xiety before follow-ups? Imagine sitting in a quiet room, heart pounding, waiting for the results of a recent scan. That feeling of nervousness, worry, and even dread is what many lung cancer patients experience before follow-up imaging tests. This phenomenon is often called scan-xiety, a mix of the words scan and anxiety. It's a common emotional response rooted in the high stakes of cancer monitoring. When patients undergo scans like computed tomography or magnetic resonance imaging, they are often anxious because the results can change everything. If the scan shows the cancer has come back or worsened, it might mean more treatment, more side effects, or even a different outlook on life. That uncertainty can be overwhelming. The main reason for scan-xiety is fear of what the results might reveal. Patients worry about whether their cancer has returned or progressed, which can feel like a threat to their health and future. Since these scans are critical checkpoints, the results can influence treatment decisions and prognosis. This makes the wait for results feel like a tense pause in an otherwise ongoing battle. For some, past experiences with bad news or difficult medical encounters can make the anxiety even worse. If someone has faced tough diagnoses or treatments before, they might associate scans with trauma, heightening their emotional response. The process of getting scanned can also contribute to the anxiety. Some people feel claustrophobic inside MRI machines or worry about radiation exposure from CT scans. Concerns about contrast agents used during imaging can add to discomfort, especially if they have sensitivities. The waiting period between the scan and the results is often the hardest part. During this time, patients live with uncertainty, which can lead to feelings of helplessness or panic. This emotional stress can sometimes cause depression or feelings of being overwhelmed, affecting mental well-being long after the scan is over. It's also common for scans to trigger memories of the initial cancer diagnosis and treatment. These memories can intensify fears about the disease returning or worsening. Because follow-up scans are usually scheduled regularly, many patients experience a recurring cycle of scan-xiety. It can persist over months or even years, becoming a familiar part of living with lung cancer. Understanding that scan-xiety is a normal and understandable response can help patients and caregivers manage these feelings better. Open communication with healthcare providers is key. Asking questions about what the scans involve, what the results might mean, and discussing fears can reduce uncertainty. Psychological support, relaxation techniques, and mindfulness exercises can also help ease anxiety. Remember, each person's experience is different, and it's important to seek personalized advice from medical professionals. In summary, lung cancer patients often get scan-xiety before follow-ups because of the emotional weight of waiting for results that can impact their health and future. The procedural discomfort, the fear of bad news, and the memories tied to their diagnosis all contribute to this stress. Recognizing scan-xiety as a common part of the cancer journey can empower patients to seek support and develop coping strategies. Always consult healthcare providers for guidance tailored to individual needs, and remember that managing emotional well-being is an important part of living with and beyond lung cancer.